We are going towards a surge. We are nowhere near flattening a curve right now. I hate to say it because we don't have enough tests to know.
Wading through this so far.
Sure. So at
City and county leaders sitting down with Wish TV to set the record straight about coronavirus. The conversation comes as 9 more cases have been reported in the state of Indiana. Good evening, everyone. I'm Brooke Martin.
And I'm Phil Sanchez. I want to take a look now at the updated numbers from the State Department of Health. The total number of positive cases stands at 39. 34 tests were conducted yesterday. Clark, Fayette, Jennings, and Madison counties are now reporting their first cases. Hamilton, Hendricks, Lake, and Marion counties have additional cases. 2 people have died. That number is unchanged from Tuesday. We have team coverage again tonight. Julia Dang looking at massive changes in the auto industry. Our Jenny Drasler is live downtown covering the shutdown of 5 of the biggest malls in the area.
But for almost an hour tonight,
we want to bring in our medical reporter, Dr. Mary Gillis, now.
But for almost an hour tonight, we took an in-depth look at the coronavirus pandemic and how to stop its spread. We invited medical professionals, school and government personnel to shine a spotlight on the issue and what we need to do to help each other. Wish TV's Dan Klein joins us now live with a look at that discussion, Dan.
Yeah, and it was a wide-ranging discussions. Why the coronavirus is worse than other bugs in the past. What about all this hoarding of toilet paper, and how to talk to your kids about all that's going on. Experts tell us there are some reasons to fear, but also reasons for hope.
I think our goal tonight is to get everyone on a similar page.
The same page, even the same room, but everyone at least 6 feet apart. A special health spotlight on the coronavirus with a unique look from the very beginning.
And I am very, very concerned.
And we know that there's some vulnerable people in our city, and it's our job as a community to look out for them.
First, the bad news. Even if we do everything right, getting through the worst of the coronavirus looks like an 8 to 10 week process. And so far, everything has not been done right. Not enough test kits yet, people not quarantining themselves.
We are going towards a surge. We are nowhere near flattening a curve right now. I hate to say it because we don't have enough tests to know.
And too many people with the wrong mindset, seeing this as just another illness, just an inconvenience that can't hurt me, leading to even some key medical supplies like masks running low for doctors. The panel says it's far more than that. In fact, fighting this battle is the right terminology.
We're fighting a war, and the problem with fighting the war is the frontline people that are fighting the war are those folks in the hospitals. The masks are our guns. So we need these to protect people so we can fight what we need to fight.
Doctors say this coronavirus, COVID-19, is different. First, it seems to be more contagious than other bugs, even the flu. And second, perhaps more dangerous, people can be sick and spread the virus before they ever show symptoms.
If you've had a flu negative test or a coronavirus negative test, doesn't mean that 2 or 3 days later you can't go contract one of those viruses. So don't get complacent.
There were a few lighter moments too.
I couldn't find toilet paper in my grocery store, so I don't know what this fascination is with
I saw a line today, Doctor.
Toilet paper.
But this is what Dr. Virginia Kane says you should have. 2 weeks supply of food, water, medications, so you don't have to leave the house if required.
Don't be taking months and just taking as much as you can. That's really not fair to all of our other residents.
And that's the message. We're in this together, even our children. Don't assume they are not aware of what's going on, and they can feel the fear and uncertainty in your heart.
As parents, we have to make sure that we're keeping the lines of communication open, we are being calm, we are providing factual information, and that we're reassuring them that, we're all working together to solve what's a really big problem. But it's solvable if we all do our part.
But that's the hope. As more testing comes, 1 million this week, hopefully millions more next week, it is solvable. A message shown by competitors sharing a stage, working together for weeks, actually in ways that's never been done before. A spotlight Wednesday that doctors hope makes a difference.
I think it should show the community that we're all united in our efforts.
Oh, it makes an enormous difference because they can look on television, they can see everything that's happening nationally, but they want to know what's happening in my own community.
Two more key points to make. Italy, which has certainly been devastated and overwhelmed by this virus, actually has more doctors and more hospital beds per capita than the U.S., and our surge is starting to look like theirs. And second, if you believe you have the virus, as long as your symptoms are moderate, the advice is to stay home, quarantine yourselves. You can take some over-the-counter meds and wait until you're symptom-free for 24 to 48 hours before going to see your doctor. Coming up at 11, I'll tell you why even the young and the healthy will be affected in some severe ways if the system becomes overwhelmed. Reporting live, Dan Klein, Wish TV News 8.
Dan, thank you. Eli Lilly announcing a major increase in testing capabilities for the coronavirus in Hoosiers. So in about a week, officials say they'll be able to test at least 1,000 people a day. That's 5 times more in one day than what's being done by the State Department of Health so far because of just limited access to testing kits. Lilly is also piloting a drive-through testing process, which they hope to unveil in coming days.
Lilly is bringing the full force of our scientific and medical expertise to attack the coronavirus pandemic around the world. And today, we're marshaling our people and our assets to confront and defeat the novel coronavirus in our state.
Lilly says the test results take about 4 to 6 hours and can be done in a batch with others, so people should be able to quickly find out if they have the virus and need to go into isolation. All testing will be completely free, both for individuals and the government.
Well, auto factories across North America now halting production to contain the spread of coronavirus. The unprecedented move will affect thousands of workers right here in central Indiana. News 8's Julia Dang, live at the Fiat Chrysler plant in Kokomo that's closing for more than a week. Julia.
That's right, Phil. They are closed through the end of March. The announcement from union and company officials comes 1 week after a worker at this factory tested positive for COVID-19. Although other workers I talked to tonight are happy about the closure, some say it should have happened earlier. These auto plant workers clocking out and heading home Wednesday won't be back until April at the earliest.
This is unlike anything I've ever been through.
Fiat Chrysler, General Motors, and Ford, often called the Big Three automakers, are shutting down factories in the U.S., Canada, and Mexico until the end of March. The containment effort, negotiated with union officials, will affect more than 150,000 workers, including Shane Waymeyer.
Nobody wants to be off work, but I think it's the safest thing to do.
He works at Fiat Chrysler's transmission plant in Kokomo. Another worker there tested positive for COVID-19 last week.
It's just been kind of a roller coaster of emotions, and I think this is the safest thing to do in everybody's interest because there's thousands of people in there, and if one person got it, it could spread pretty rapidly.
Company heads say new factory protocol will be in place before they resume production. It could entail keeping people farther apart during shifts and shift changes. No word on how that might affect production, but Indiana will be uniquely affected. The Hoosier State is home to more than 500 auto companies. They contribute an estimated $15 billion to our economy. More than 100,000 Hoosiers work in auto manufacturing, which is 450% above the national average. Many won't be getting their full paychecks during the production halt. But Waymeyer is more worried about his well-being than his wallet.
If it starts to slow down, I would have no problem going back at the end of March, but if it's just as bad as or worse as it is now, I would be a little more apprehensive.
Following the announcement from union and Big Three officials, other automakers followed suit, including Honda, which operates a factory in Greensburg, and Toyota, which has a factory in Princeton, north of Evansville.
Hopefully it'll just run its course and we can all get back to work, and that's about the best you can hope for.
Shane Waymeyer tells me he and his coworkers are getting unemployment benefits and supplemental pay during the closure. Union officials haven't shared details yet about closure compensation. Live in Kokomo, Julia Dang, Wish TV News 8.
Julia, thank you. The Indianapolis-based Simon Property Group announced that it will be closing all of its malls nationwide.
That includes several right here in central Indiana. News 8's Jenny Drasler is at the Circle Center Mall in downtown with all the details. Jenny.
Yeah, Fellendruck Circle Center Mall has been closed for about 3 hours now after Simon Property Group announced this afternoon that all of its locations across the nation would need to close by 7 o'clock tonight, and they'll remain closed until March 29th. Now, News 8 did get a statement from Simon Property Group's president that said, quote, "The health and safety of our shoppers, retailers, and employees is of paramount importance, and we're taking this step to help reduce the spread of COVID-19 in our communities." Now, Simon has properties in 37 states, and according to the group's website, Simon Properties rakes in an estimated $60 billion in annual sales with 3 billion annual customers nationwide. Now, the closures will make a big impact in central Indiana as Simon owns 10 malls across the state and 5 malls right here in the Indy Metro, including Circle Center downtown, Castleton Square Mall, the Fashion Mall on the north side, Greenwood Park Mall, and the Hamilton Town Center in Noblesville.
I just don't like how it's going to affect all the businesses and all that. I feel like it's going to hurt a lot of people. At the same time, I feel bad for these small businesses that are losing their hours because, like, they need money and, like, to provide food for their families but we just got to carry on from here on out.
I think we just got to get done. I mean, if it hurts businesses, that really stinks, but if it helps, it helps.
Now, this move comes after many individual stores inside malls across the nation announced that they too would be closing stores as well. Now, Simon is a nationwide group. This impacts places not only here in Indianapolis, but other major metropolitan areas, including Houston, Charlotte, and Boston. Live downtown, Jenny Dreisler, Wish TV News 8.
Jenny, thank you. The 500 Festival Mini Marathon will be virtual this year. Coronavirus concerns have suspended all planned in-person events for the 500 Festival through May 9th. So that includes the kickoff event, the Mini, the 5K, and the Mini Marathon Expo. Organizers say the decision is in accordance with guidelines from the CDC. Anyone registered for the Mini Marathon this year will get details on how to participate virtually. The people behind the 500 Festival say they're going to do everything they can to minimize the economic impact of the changes.
Well, registered voters here in Marion County will each be getting an application for an absentee ballot. Indianapolis Mayor Joe Hogsett making that announcement this afternoon. Indiana's primary set to take place on May 5th. Early voting starts April 7th. Mayor Hogsett and City County Council President Bob Osley says that requesting an absentee ballot will allow people to send in their ballots by mail so they can vote while protecting their own health and safety.